Hey everyone, and welcome back to the Rules of Thumb podcast with Dr. G. I'm your host, Nick Golinvaux, and I write a weekly newsletter on all things musculoskeletal health and longevity. That means fewer aches and pains and a better knowledge of what to actually do when they inevitably rear their ugly head. In this podcast, I will read to you my article of the week so that you can listen to it on the go. If video is more your thing, welcome to those of you watching on my YouTube channel. So without further ado, let's get into this week's article titled Your Guide to Carpal Tunnel Syndrome. So, carpal tunnel syndrome, in its most basic form, is an extremely common and painful pinched nerve at the wrist. Specifically, the median nerve is pinched as it passes through, the carpal tunnel. The technical term for a pinched nerve is peripheral nerve compression. So, what is the carpal tunnel? The carpal tunnel refers to an anatomic space in the wrist. If you imagine a literal tunnel with the floor beneath you and the walls on either side are made up of the bones in your wrist. If you're following along in the newsletter, you can see the drawings that I've included there. We'll also link that in the show notes. And then the roof of the tunnel is a thick ligament known as the transverse carpal ligament. There are tubular contents that pass through the tunnel, and those include the median nerve, as well as 9 flexor tendons. When activated, these are the tendons that bend your fingers down into a fist. So very simply, carpal tunnel syndrome is a pinched median nerve. Now, if anything compresses the median nerve inside this tunnel, you will feel the symptoms of carpal tunnel syndrome. So here are a few ways that pinching might happen. The first is sleep. When we sleep, we all naturally flex our wrists. Conversely, when we type, most of us extend our wrists. These changes in wrist position will alter the volume of the carpal tunnel, and that results in higher pressure within the carpal tunnel. The second one is age. So the thick ligament that forms the roof of the carpal tunnel sort of naturally thickens as we age. As the ceiling of the carpal tunnel slowly collapses down, the median nerve will be the first thing to squish, leading to carpal tunnel syndrome. Another one is inflammation. So this is less common, but serious inflammatory conditions, such as rheumatoid arthritis, can lead to swelling of the 9 flexor tendons within the carpal tunnel. If the flexor tendons swell, they have nowhere to expand within the tunnel, and the carpal tunnel pressure will skyrocket. Yet again, a pinched median nerve. And the last one is pregnancy. So in pregnancies, we get hormone shifts that can cause an increased volume of fluid in the tissues of the carpal tunnel. Again, more volume within the tunnel means higher pressure on the nerve. Pregnancy-induced carpal tunnel syndrome is very common. I want you to think about the pinky finger as your guide to carpal tunnel syndrome. So far we've talked about how carpal tunnel syndrome occurs, but what are the actual symptoms? Classic carpal tunnel syndrome includes some combination of numbness, tingling, burning, or shooting pains felt on the palm side of your thumb, index finger, middle finger, and the inner part of your ring finger. These symptoms are typically worse at night, and they can wake you up from sleep, sometimes multiple times a night. Carpal tunnel syndrome, though, does not involve your pinky finger. Again, if you're following along and you can see the drawing, you can see how the yellow nerve branches don't travel out to the pinky or the pinky half of the ring finger. So if this is severe or long-standing, carpal tunnel syndrome can actually result in weakness or atrophy, which means loss of the muscles of the base of your thumb. And these are called your thenar muscles. These muscles look smaller on one side compared to your other hand. Please run, don't walk, to a hand surgeon. So I get this all the time. Dr. G, I need sleep. How do I cure these awful symptoms? As common as carpal tunnel syndrome is, there are infinite myths regarding how to treat it. And before I mention some of your options, I do have one hard and fast rule if you decide to seek relief on your own. It's okay to try a few things at home first to see if you can sleep better, but you cannot ignore long-standing nerve symptoms. That is how you get into the territory of permanent nerve damage that not even surgery can fix. That loss of muscle that I mentioned above, that's permanent, completely irreversible. So give a few months of treatment a try on your own first if you like. But if it doesn't work, you do need to get yourself to a hand surgeon for formal care. Currently, the mainstays of treatment for carpal tunnel include nighttime wrist bracing. Remember, we all bend our wrists at night, and that pinches the nerve all night long. A steroid injection into the carpal tunnel, or a relatively minor surgery to decompress the nerve. Unfortunately, in most circumstances, treatments like therapy or oral medications don't provide any meaningful relief for carpal tunnel symptoms. So a few takeaways. Carpal tunnel syndrome is caused by a pinched median nerve at the wrist. The symptoms include numbness, burning, or tingling in the thumb, index finger, middle finger, and half of the ring finger. There are some non-operative treatments that are worth trying, but it is not safe to ignore these symptoms for extended periods of time. There is much, much more to discuss about carpal tunnel syndrome. Entire textbooks have been written about this condition. But hopefully you now feel a little more comfortable with the basics. You can apply what you know to your specific symptoms. We will certainly build on this in future articles. Hope you join me. Thanks.